Hey, what's up, everybody, and welcome back to the channel and to another reaction of The Pitt. This will be episode 5. I guess what math would be, 11 a.m., I guess, based on the math.
Probably.
So yeah, again, 5 hours into this busy ER shift. Can't wait to see what is in store with Dr. Robbie and the gang today. But before we jump into it, again, thank you so much for being here. And we've been absolutely blown away by all of the amazing comments you guys have left. Really encouraging, really supportive. I think I made the comment last video that it feels like we're part of this community now, and that feels even stronger now. So thank you so much for being here. Oh, I guess I have a bad habit of not introducing myself.
I was about to remind you. I was almost there.
You didn't have to. I am Dr. Todd, internal medicine doctor working in primary care. For those of you who are coming back, I guess just bear with me repeating that every time. But if you are new here, hi, and this is my wonderful wife, Allycia.
What's up?
She is a muggle. You'll have to watch the previous episode to get that joke, that reference. That was a popular, I guess, comparison?
Yeah.
Popular reference.
After we recorded that, you're like, I don't think anybody's going to get it.
Oh, I don't know if
cut that out.
I don't think I said that. No. But it was well received. I guess people like that kind of analogy. Muggle, wizard. I guess that makes me the wizard.
Unfortunately.
Which is pretty cool, I think. I guess I would be House Gryffindor. I don't know, just because Harry Potter. But anyway, enough of that. Believe it or not, I do own other shirts than just sports hoodies.
Not many.
But this is primarily what I wear. And so I'm kind of wearing the last one supporting the Kentucky Wildcats. We did have a comment about that, about Kentucky, go Cats. Growing up in Cincinnati, big Cincinnati fan, but my father and mother, actually both families come from Kentucky. So big Wildcat fans. Also had a comment about the Columbus Blue Jackets. Asked if I was a fan of the Columbus Blue Jackets. So not a big hockey fan, admittedly. I guess if I had to claim a team, it would probably be the Blue Jackets just because of proximity. We have been to a few Cincinnati Cyclones games. They're not NHL, but they are. They play for the Kelly Cup, so whatever division that is. But anyway, all right, enough rambling on. Any comments before we jump in?
No, I'm just hoping we see Dr. Mel.
Oh yeah,
but there hasn't been enough of her the last 2, right?
Yeah, it was so last episode she was not showcased as much, but I think they're sort of doing that. They're showcasing certain, residents, doctors. Obviously Dr. Robbie has been kind of the mainstay, the anchor, if you will. But I think maybe we'll kind of circle back a little bit. I mean, and then there's the Cassie, I think her name is, Dr. McKay. We may see a little bit more into her backstory. Maybe why she's wearing the ankle monitor.
Yeah.
So we'll see. All right, guys. Well, hey, let's jump right in.
All right.
So this was the guy that was in the waiting room.
Seizure and shares.
That's about right. I was about to say that. So that's interesting because they gave him lorazepam when he hasn't been seizing for 5 minutes.
Oh yeah, no, you're going to treat the acute seizure. He's not yet in what's called status epilepticus, but yeah, you're going to treat it.
You'll have to write that down, explain that to me a little bit more. One of our children has epilepsy, and as far as I'm aware, that you don't treat until 5 minutes, but that could be different for our situation. So.
Yeah, we can talk about it. Yeah, so cellulitis is one of those top 5 admission diagnoses that we see. So this is bread and butter medicine. Gosh. This poor guy.
They just think of everything they could hit him with. Urine.
Yeah, he's been peed on. He's been bled on. He had the bottle of Maalox or Maylanta makeshift tourniquet.
Thank you, Dr. King.
Oh, yeah. King. Mel King. That's right.
With blood all over his face.
Yeah, let him go clean up.
There's probably protocol.
Well, yeah, actually,
too,
so
right?
now he's been exposed to a bodily fluid, and so now he's got to undergo some testing.
Yeah.
Oh, sorry. I just
Made an excellent catch and saved Mr. Chasen's life.
Really?
Is that exactly true, or is she just trying to?
No, you can have.
Okay.
Yeah, you can have significant bleeding from that. Actually, I've seen it. I've had patients with that.
Wow.
Because arterial bleeding is profuse bleeding. because it's under pressure. So you can lose a lot of blood very quickly.
Christy Wheeler, 17 years old, pregnant. These are Abbott's fetal measurements from yesterday, and these...
She's further along.
The only thing I'm a little bit unsure of, and maybe if there's anybody out there watching who has experience with this, but I'm not sure that like a medically facilitated abortion will be happening in the ER. I feel like this is something should be done through the OB. So that, I could be off base because in primary care we don't really see this, but that's something that's a little confusing to me.
She needs 24/7 assistance with ADLs.
Are you the primary caregiver?
I don't know if you caught what she said there, but she said needs help with all of her ADLs. I don't know if you know what that means.
I do
but
not know what that means.
Activities of daily living.
Oh, okay.
Anytime someone uses that, you kind of figure they're either involved in healthcare or at least have enough involvement to understand that terminology.
Oh, there he goes again. More scrubs.
They should let him check out too.
Yeah. He needs to go take a shower. I was just waiting for them to be like out of scrubs.
Our dog has really bad allergies.
Yeah, she's struggling with her breathing. I think they'd mentioned in the earlier episode that she had acute chest syndrome. So had developed basically like a pneumonia, which can compromise.
Did she have sickle cell?
Yeah. So that's a consequence of sickle cell. It's one of those more advanced complications of sickle cell.
Okay. Is sickle cell more an African American?
Yeah, it's African Americans.
Okay.
Hypothetical question. Would you ever go over a resident's head to the attending?
Hypothetically, I wouldn't recommend it unless it's a behavioral issue or harassment. And in that case...
I wonder what she's getting at with that.
I'm taking it as she's like just not happy with him of not getting things wrong.
Yeah, I don't know. There's something there with that Ativan.
Do you think she thinks he used it?
Maybe. I don't know. I think she thinks it was tampered with.
Like more so than just her ego. Like she's not.
Right.
Okay.
And to her point, that much Ativan should have worked. I mean, in theory.
And I assume Ativan is a drug that is abused.
Oh, very high abuse potential.
That's not the sleep one, is it? No.
Well, some people can use it to help sleep.
Oh, okay.
Be back to joint custody just as soon as I get this stupid thing off next week. Three people.
The dark humor.
I know.
She shared a
I'm
little
sorry, it
bit
was a
too much
bad joke.
information and got uncomfortable.
Yeah. Yeah, we'll talk actually about this at the end, but connecting with patients sometimes through personal stories is pretty useful strategy. Obviously, she's sharing very intimate information, which
Yeah.
obviously you could argue maybe she shouldn't do, but it seems to be working.
Yeah. You think she knew she was an addict, and that's why she brought her back as soon as she came back to the ER.
Oh, perhaps. Yeah, I don't.
Proximal humerus fracture on the left upper arm.
There goes my backhand.
Oh, she's funny.
How hard it can be. I was my sister's primary caregiver until a few weeks ago.
Oh, we're definitely getting more Mel this episode.
She's in an amazing
been good.
facility in North Hills.
How long did she say she's been in the facility?
I think 2 weeks.
Oh, wow. So she was trying to do residency? Wow.
I guess, yeah. And I can't recall where where Mel is in her training. I can't recall if she's like an intern or not. Well, no, she said she completed a portion of the VA, so she should.
That's right.
So she's shouldn't be an intern.
You know, caretaker's fatigue is a real thing.
I wrote that down.
You did? Okay, because I know we were
Take
talking
care
about
of
that the
yourself,
other day.
otherwise you're going to end up in here too.
Not to be confused with mental fatigue, though.
Yeah.
Quick as you can. Let's go. Trauma 2. So this can go south pretty quickly. You up for it?
Well, I can.
Of course you are.
There's been blood on already, so.
Oh, gosh. Yeah. What else is going to happen to him?
I mean, there's still more bodily fluids, but hopefully we don't get any of those.
Parents on the way?
They're in Baltimore for a wedding. I didn't want to bother them.
Don't bother. He has the notebook. That's what he started to say. He walked out of gave him the pen, but left with the notebook.
Oh, yeah.
The number. Is he going to write it on his arm or something?
I mean, he's a recognizable actor. I can't remember from what, but I've seen him. Oh,
Took his
someone's
seat.
in your seat.
Oh, that's that guy.
Yeah, he gets it.
So that's his son?
Okay, so yeah, I was just going to ask, like,
Yeah.
do we actually know who he is?
Oh, God.
Well, everyone's taking care of him. Yeah, they're really kind of promoting that family feel because all the staff knows him, treats him very well. They're very comfortable with him.
Where's Teresa?
She went to park the car. Shouldn't have been more than 5 minutes.
Why don't
Don't worry about it, though. I'll talk to my attendant.
I knew it. I knew it. God.
Well, yeah, I mean, it's
Yeah, at this point, though, it's a little...
yeah, this one's more of a like a legit emergency.
Before we begin, let's take a timeout.
So timeout. This is to make sure every single person in the room is aware of what is happening, the procedure, the patient, that consent's been obtained, all of the above.
Surgery coming in. She's just so, like...
Yeah. Although I can't recall specifically what surgery, like what surgical specialty she is.
Wouldn't you want to do plastics or something?
Oh, I don't recall.
I'm in.
See how you kind of pulled back there a little bit? You kind of pull back to make sure, A, you're not in a blood vessel.
Yeah.
So listening to the airways, both sides, to make sure that the tube is in the right place.
Sats 92 and raising.
And then you typically would send them for an x-ray here as well to make, like, to confirm it.
Okay. What are they doing?
Okay, we're done playing doctor.
They're floating the
All right, we tried.
tube over this wire because they don't have great visibility. So, but the wire is in the right place, so they can float it over that wire, and then it ends up in the right place
To do what?
to get an airway.
Oh, he doesn't eat, like he's not breathing.
Right, like
Okay.
his oxygen's dropping down because
Okay.
he's not able to oxygenate his lungs.
Fentanyl overdoses today. It's not even noon.
I promise.
Okay.
Hey, basketball Sunday?
Yep, wouldn't miss it.
Hey, before you go. Please don't hand me a condom.
Give you extra cash.
You'd be like, "Who gave you the condom?"
My daughter is a minor,
Oh.
so
I don't know about
she
that.
can't get this
Is that-
abortion without my say-so, right?
I don't know the law. Like, I think the
Is that
law
right?
is state to state.
That's correct.
All right.
All right, another episode in the book, and no pun intended. I have my notebook here, so
Got your handy dandy notebook.
that's right. I don't know. What are your thoughts?
I don't know. It was a lot of bleeding.
Yeah, yeah, a little more like, I guess, kind of going back to some of the medicine here, like
Yeah.
some
Still
of the
not enough of Dr. King.
yeah. Well, we were told that she shines in episode 7.
7.
Okay, so 2 episodes away. Yeah, I mean, obviously a lot of bleeding here. Our one poor, I think he's student doctor. So
Yeah, he's an intern, right?
again, see, I struggle sometimes remembering who's like what the hierarchy is here.
But I thought he was an intern.
I thought so too, which would not
Be a student
by
doctor.
definition
I know,
be a
I was
student
confused
doctor.
on that too. So we'll have to double check on that.
Yeah.
Because if he's an intern, I guess you could explain a little bit more about that. It's not a student doctor.
Yeah, I would never refer to an intern as a student doctor. Although med student is technically not a doctor, so you wouldn't. Sometimes you hear them referred to as student doctors,
And
but
he's referred to as doctor, right?
right.
So he's not a student doctor.
So, but a med student's a med student, and an intern is a doctor. They've graduated medical school. They've completed all their licensing exams, and then obviously you traverse the residency years up until you're an attending or maybe fellowship. But anyway, so some bad luck with him that continues. Some of that's been kind of funny. Obviously, the one that just happened was not so funny because that was an emergency.
I was just thinking he hasn't been defecated on yet.
That is true. Hopefully we don't see that. So anyway, yeah, less sad episode.
Yeah. That was.
So last
a little
couple
bit
have
relieving.
been pretty rough emotionally. Not that there wasn't sad moments, obviously, and we'll kind of talk about some of that. But so I wrote down a few notes. Feel free to jump in. I'll try to get through this without boring anybody. But yeah, you wanted to write down the Ativan because you had questions about that because of the prescription that you were referring to for our child who has epilepsy. It says do not give unless seizure is longer than 5 minutes.
Yeah.
So if I'm being honest here, this may be one that I'm not sure if my answer to this will be completely accurate. So they're right. Status epilepticus, which is very dangerous.
Yes.
The neurons are basically frying at that point.
But that's no break in.
Yes,
Right.
that's persistent
5
seizure
minutes?
for 5 minutes.
Yeah.
Perhaps the difference here is this. So our child does not have, quote, complex seizures, does not lose consciousness. They're partial
Yeah.
seizures. And so that does play a little bit of a role here. And then the other thing, too, is unfortunately, because of the age, the medication is a rectal medicine. So I think that could be part of it. But yeah, if you're in the hospital and you see somebody seizing, you're never waiting 5 minutes to say.
Okay. Yeah, that makes sense.
No, you're going to go ahead and give them medicine. It was a pretty hefty dose of Ativan. I personally have never seen that high of doses given in the seizure. If you may remember from my story from one of the earlier episodes, actually one of my very first, what we call rapid responses, was for a seizure. Now in the ER, again, a little different because I worked up on the floor. I can't maybe speak to all of the accuracies of what the ER would do, but then that kind of prompted the other, I think it's Dr. Santos. She's got some questions about that.
Because he wanted to get her to give another dose, right? And she's like, that is a lot.
Yeah, so there's something there brewing with that. We'll see.
Yeah.
I don't think it's just that there was a faulty vial.
Right.
So that's kind of interesting. So I wrote down about, so there's Dr. Robbie seems to have a lot of admirers. And that made me think of a story. Many, many years ago, I had a patient, and this poor patient has, she's passed. She was older. But anyway, I remember going in the room, and I can't remember exactly what I asked her, but I asked her if she would be willing to do something. I don't know, check something. And she said, "You can do whatever you want, Dr. Sexy Pants." And so I was a little caught off guard. I was like, what?
Man, I wish I could have been in that, like, fly on the wall just to see your reaction.
So she said it again too before the end of so at first I'm like, what did she just say, Dr. Sexy Pants? And then again, I can't remember exactly because this was many years ago. And I remember telling you, I remember coming home and saying, "Hey, just so you know, I got called Dr. Sexy Pants today." Do you remember what you said?
No, I don't remember this conversation.
Okay. You asked if the patient had dementia and if they were visually impaired. So yeah, this is the kind of relationship we have. She's very nice.
I'm not mean.
I know. I'm kidding. Honest. So I know we've not done a whole lot of deep diving into like our past, but I feel like sometimes our relationship should go with a little disclaimer.
Yeah. Sometimes like when we go into like what was it? Was it a school interview or meeting like teachers for the first time? No, it was like when our older was in like 3rd grade, and we went in for the parent-teacher conference.
Oh, yeah.
And we're like arguing back and forth, but they don't know we've known each other since we were 5, and we'll be married 20 years this year.
Yeah.
So we talk to each other because we've known each other our whole lives.
Yeah.
And I've always told him, the day that I stop arguing with you is the day you need to worry, because I no longer care.
Well, yeah. So that background I think is important.
Yes.
We've known each other since we were 5. Basically, grew up 2 doors down. Started dating, if you can call it that, when we were like 13, and then got married right out of high school. So, so we've been part of each other's lives forever. But anyway, so yeah, that comment. So the answer to that question was yes. And the patient was demented, pleasantly demented, I like to say. But she was a very sweet lady, very sweet family. Unfortunately, she passed many, many years ago now. But that was a nickname that I carried, and actually some of the nurses will still occasionally bring that up if they're trying to be funny. So Dr. Sexy Pants. Anyway, something that happened in this episode that was kind of it comes up a lot in medicine. Sharing too much of your own personal story sometimes with patients. Or really, this can be in any industry, really. I mean, but should you where's that line draw?
Yeah.
And so this was
hard.
Yeah. And so again, I'm drawing a blank on her name. Dr. McKay, I think is what her name is. Sharing a little bit of her own personal history, which worked. She connected.
Because, I mean, well, she was an addict. From what she said.
Yeah.
I'd imagine that's a hard. I don't want to say diagnosis, because that's not. Just like to get a person who is an addict to open up and get help.
Yeah, to be comfortable with you. Yeah. There will be a lot of debate on this, and you'll get different answers from different providers, I'm sure, different medical personnel on how much information is too much information to share. That's I guess that's a line that each person has to try to walk themselves. I mean, there's no strict guideline there. I do find though it is helpful oftentimes to try to connect in certain ways with patients, because I think they do start to trust you. I can't tell you how many times that a patient has come into the office. Now, I've been doing this long enough where a lot of my patients I've known for years, and so that helps. But I can't tell you how many times a patient meeting for the first time coming into the room, when my nurse rooms them, they tell the nurse that they're that they don't really have any concerns. They're just here for a checkup. I come in, they kind of say, yep, no, nothing wrong. As we conversate and as we connect and start to, now, because, at that point, it's more than just medicine. We're connecting, on a personal level. And I can't tell you how many times that has led to them actually sharing legitimate concerns.
Yeah. Where they didn't have any before.
Right. Like, because now we felt comfortable. Now they felt comfortable to say, you know what, maybe there is this one thing, hey doc, there is this one thing that I'm experiencing. And I view that as a huge win when that happens. Cause I'm like, okay, yes, that means we've successfully built that rapport, is I guess the term you call it. I guess that debate raged on a little bit about whether that was too much to share or not, but certainly it was a very personal story, very personal, or a lot of personal information there.
I mean, I think she truly wanted to help her.
Oh, without question, yeah.
Since she had been on that side herself, she knew that she had to connect with her.
Oh, it was done, and it was done altruistically.
Yeah.
Like it was
just very brave, honestly, for the doctor to share.
Hard, yeah, because that information could be used against you too. So that's, it is something you have to be careful with. The other thing I wrote down, because this is a super big issue, especially in my world, and again, outpatient primary care, the concept of caregiver fatigue.
Yeah.
The burden on caregivers, it's a very real thing. I wish we had more resources for this. This is one of my biggest frustrations, is the lack of resources for these things, because there's just not enough. And I don't know this, I don't have an answer per se, but I see it all day long. And especially too, because being a primary care doctor, I'm oftentimes, it's not uncommon for me to have an entire family in my panel. I may have 10 plus members of the same family, from the grandparents and the parents of the children and the aunts and the uncles and things. And so I can kind of see those multiple layers, that multi-dynamic, and it's hard to see them go through it. I help as much as I can, but
and when you talk about caregiver fatigue, I'm sure there's more to it than just caring for your elderly parents.
Oh, sure.
It could be elderly people caring for their children.
Yeah, certainly special needs kids. It goes all the way around. It can be a 360-degree thing.
Yeah, but when those special needs kids become adults,
right,
there's not as many resources.
Right, and that's a problem too. And that's the thing, not that this is a direct connection to that, but I was saying, I think I mentioned this in one of the podcast episodes. I don't know if I've mentioned this in these episodes, these reactions, but this is partly why I became a primary care doctor, to be able to kind of be invited into the family and really kind of, connect with all of them and try to help in any way I can. Because, I always say, the reason when people ask me why I do this, I say, or why I chose this particular specialty, it's because, when you go to the doctor, when you go to the emergency room, or you're in the hospital, or whatever the case may be, and your family or your friends call you and they're checking in on you and they're like, hey, what did they say? People will be like, oh, well, the doctor said this. Well, the nurse said this. Well, the doctor said this. But when you're their primary care doctor and they come see you, when that question gets asked, they say, my doctor said this. And that distinction is very important to me, because you're not just the doctor, you're their doctor, my doctor. So that's what I find so cool about primary care. I think that's about it on the burden part. That's a tough one, because I said there's just not enough resources out there for that. And then the last one, I was excited to talk about this because finally it came up, the ego in medicine.
Oh yeah,
I've been talking about that
subject.
Well, because I hate it.
You love it because you hate it.
Well, yeah, because it is so pervasive in medicine.
You hate it like you hate that people accuse it, you hate that it exists.
I hate that it exists.
Yeah.
And don't get me wrong. Like, so what I mean by that, because I may have touched base on it in one of our earlier episodes, but these like competitions between specialties, or even just between healthcare workers in general. It's like this concept that you have to extinguish somebody else's flame in order for yours to burn brighter. And so there's always that put down and like, oh, these doctors don't know what they're talking about. These nurses don't, whatever. And I hate that because I see it all the time. I've experienced it. I've been on the other end of it. And this show we haven't seen a ton of it yet.
I thought that's what we were seeing with the intern with the Ativan, but you see it as she may feel like she needs to report
something fishy. Yeah. And you can see, there is a hierarchy here though too, and so that does play a little bit of a role, right? So he's the senior. I don't know if he's a chief, but he's the senior resident. She's a junior resident, I think maybe even an intern. So there's that hierarchy. So yeah, absolutely, there's a natural quote pecking order. Of course, that doesn't mean that you treat people without dignity and respect. And that, of course, ego can come into play there, though. But yeah, so I didn't know exactly what he was doing when he was talking on the phone. I didn't know who he was talking to. He was talking to ENT, so ear, nose, throat, telling him about things. And they said it's not their problem to fix another hospital's problem, basically what they said. I can't even tell you how infuriating that would make me.
You're trying to help the patient.
Right, because at the end of the day, there's a person on this bed who's bleeding. And I don't care if it was some other doctor's mistake or presumably you treat the patient.
Well, there is a risk of hemorrhaging, right?
Sure, for sure. Yeah. It doesn't necessarily mean it was a mistake. But the point being, that was completely inappropriate. If you ask me, that's extraordinarily inappropriate. But again, it speaks a little bit to the authenticity of this show, because that's not that uncommon. Where you'll hear this, or you get a specialist, and I'm not here to disparage any other specialties. I think they all do great. I think whenever I have a problem, I usually have a problem with an individual, not. That's not indicative of the particular specialty.
Yeah.
Actually, I can tell you that interestingly, the worst I was ever treated, was actually by a surgical nurse. Again, this isn't to go against nurses, because I've mentioned many times how much nurses absolutely save the day. But this particular nurse.
So it was a person. It wasn't because she was a nurse.
This particular nurse was extraordinarily rude. So I'll do a quick story on this. I was a med student. I was on a surgical rotation. I had no interest in surgery, but like any other kind of professional, I showed up, did my job. It was never rude or inappropriate. But anyway, I remember walking into the OR in a case that I was not scrubbing in on. The surgeon simply just wanted me to go in and observe. And I walked into the OR, and it was a new OR to me, because it was a rotation at an outside city. This OR nurse comes up and says, "You can go get your own gloves. I'm not your mama. Something that I'm not here to hold your hand. You can do it yourself." Whatever. I just was like, what? First, I wasn't even scrubbing in. I would have no problem going and getting my own gloves. Never would I expect somebody to do it for me. But just that assumption that I was coming in here as this medical student and that I was going to expect her to. But unfortunately, my guess is, there's a saying, hurt people hurt people.
Yeah.
My guess is she had been hurt somewhere along the way and felt like she
had to put on a strong front.
Well, and again, kind of goes back to the hierarchy, because that exists in medicine, and I think that's where some of the ego comes into play. And again, it's not a matter of, that doesn't, just because you may be higher on the hierarchical playing field doesn't mean you have the right to treat people poorly. And so clearly this person had been treated poorly, I'm sure, felt obligated to then treat me poorly for no reason. Ego in medicine, it's a terrible thing. Look, I've been guilty of it. I'm not saying that I've never cast those stones, but I try really hard not to.
Yeah.
So anyway, that's all I wrote down tonight. Any closing?
No, I think it's just needs some more Dr. King.
Well, yeah, we're going to get into some of the more of that. Okay, so episode 6 coming up. We're going to watch this tomorrow. So we're actually going to try to get caught up here pretty quickly. So again, we appreciate the patience and bearing with us. Yeah. And also, I guess on a closing note too, we've actually started to get a few recommendations for other shows. All right. Which has been nice. Now, I know we still have 10 episodes of this we got to watch.
We got a while. We got a while here.
So we won't get to those just yet. But I've seen one for House, which is probably more actually up my alley, because that's my understanding is.
What is he?
I'm pretty sure he's an internal medicine doctor.
Oh,
and so that's
you might like that,
right?
Or not.
Well, I guess so. My
is he a hospitalist though?
Presumably.
Okay.
Yeah. So my experience is probably more in line with maybe this show. So I don't know. Maybe I'm not here trying to be critical of anything. It's just. But I suppose I can maybe speak to some of the authenticity of that a little bit better. I've had that. The Good Doctor, somebody recommended The Good Doctor. Grey's Anatomy was thrown out there as well. And then I think even Scrubs. So if anybody has any suggestions or is really eager to watch us, come along with us as we react to something else, feel free to put in the comments. We'll try to get around.
And we love reading the comments, keeping up with all the backstories on everything that we haven't been able to Google.
Yeah. All right, guys. Well, hey, till next time, see you later. I keep wanting to do our sign off for the podcast episode.
What's your
Live well.
Wow. No. You're gonna make it weird now.
Well, no, it's not that aggressive. Go watch an episode.
That wasn't aggressive.
No, I'm saying I'm not usually that aggressive with it.
So we were just live well.
All right. Have a good night. Take care.
All right. See ya.